During the 2021 virtual GU Cancer Symposium, there were a lot of presentation, very interesting presentation in the field of kidney cancer overall. We've seen the first results from the CLEAR study. We were all waiting for that study, the 3-arm study of standard sunitinib versus lenvatinib everolimus versus lenvatinib pembrolizumab, the VEGF-IO combination. And we've seen consistent clinical benefit with lenvatinib plus pembrolizumab in terms of overall survival, progression-free survival, and response rate, with the longest PFS to date around 24 months and a complete responses rate of 16% overall, with an overall survival benefit. So no doubt the combination of pembrolizumab and lenvatinib is going to be a player in the frontline setting of metastatic clear cell RCC. We cannot compare that combination to other ones, such as cabozantinib, nivolumab, ipilimumab, because the patient population are quite different in these studies. I think hopefully future data sets and updates out of CLEAR that look at quality of life, that look at certain risk group, that look at specifically also more updated data cutoff, and the result will be very important. Also during the symposium, there has been updates from Checkmate 9ER, which was presented during the ESMO 2020, with more updates in terms of follow-up. The median survival remained consistent. OS was achieved in this population of patients that received the cabozantinib plus nivolumab frontline versus sunitinib. Also, there was a presentation by Dr. Sella looking at specifically at quality of life. It's an extensive quality of life and patient-reported outcome from the combination of cabozantinib nivolumab with cabozantinib 40 versus sunitinib, showed consistent benefit with the combination over sunitinib. This was one of the most extensive patient-reported outcome presented for a VEGF-IO combination. Now, also with cabozantinib, two quite interesting abstracts. One, an oral presentation in very hard to find population of metastatic papillary RCC. Cabozantinib was found to be superior to sunitinib. This was a study presented by Dr. Pal, a SWOG study that showed in metastatic unselected papillary RCC, cabozantinib provided consistent benefit in terms of progression-free survival over sunitinib. This randomized phase 2 mirrors the randomized phase 2 run by another cooperative group, Alliance, with clear cell RCC, and found cabozantinib to be largely superior to sunitinib in the frontline setting. There was also a presentation that I had the chance to be part of, two presentation with the HIF2 inhibitor belzutifan, first-in-class HIF2 inhibitor that showed single-agent activity with an updated result from Dr. Todd Bauer, responses 25%, consistent across all IMDC risk group. But also importantly, we presented data combining belzutifan, the HIF2 inhibitor, with cabozantinib, the VEGF-R inhibitor, as well as TKI that work against multiple kinases involved in mechanism of resistance to anti-angiogenic. The combination was quite tolerated despite dose reduction, so it's possible to combine both drugs. We presented also data from that abstract about efficacy. And interesting enough, there were responses, and many of these responses were durable. It's an early look. Despite the median PFS was around 17 months, many patients, it's still a bit unstable. Many patients did not have follow-up over 17 months. So I think this is overall a good GU ASCO in terms of kidney cancer. There were some subset analysis from Keynote 426. There was experience with immune checkpoint inhibitor and radiation. It was Dr. Chankar, and there was also data on VEGF-TKI cabozantinib in brain metastases showing intracranial activity. So I invite you to go and look at the oral presentation, the rapid fire, and as well as many interesting posters here during this virtual meeting. And I hope really that the next meeting in San Francisco, still in 2022, will be all together again and not virtual. Thank you, and I hope you're having a safe and a great day.